What if I told you when an Amish woman goes into labor at 3 a.m., a midwife drives to her farm, delivers the baby in the bedroom, and leaves by noon? Here is the complete process from call to recovery. The call. The phone rings at 3 a.m. The midwife answers immediately. An Amish husband is on the line. His wife's contractions are 5 minutes apart. She is having her sixth baby. The midwife asks a few questions. Has the water broken? Is there any bleeding? The answers reassure her this is normal labor. She tells the husband she will arrive within 30 minutes. Her medical bag stays packed and ready. She grabs it, dresses quickly, and heads to her car. Drive to farm. The farm is 20 miles away down dark country roads. The midwife drives carefully, watching for buggies. This is her third delivery at this particular farm. The route takes her past sleeping farmhouses and empty fields. She uses the drive time to mentally review the mother's history. Previous births were uncomplicated, no medical conditions. This should be a straightforward delivery, but she remains alert for anything unexpected. Home birth requires vigilance because hospital backup is not immediately available. Arrival assessment. She pulls into the gravel driveway. A kerosene lamp glows in an upstairs window. The husband leads her upstairs to the bedroom. The mother is in active labor, breathing through contractions. The midwife washes her hands thoroughly in a basin of warm water. She checks the mother's blood pressure and pulse. Both are normal. She listens to the baby's heartbeat with a handheld Doppler device. Strong and steady. She performs a vaginal exam. The mother is 6 centimeters dilated. The midwife estimates the baby will arrive within 4 to 6 hours. Labor management. The midwife settles in for the duration. She monitors contractions and checks the baby's heartbeat every 15 minutes. She encourages the mother to move around if comfortable. Walking can help labor progress. The midwife adapts to whatever position the mother finds most comfortable. Between contractions, she offers water and reminds her to urinate regularly. A full bladder can slow labor. The husband stays in the room, sitting quietly. Downstairs, older children stay quiet under the supervision of a grandmother who has come to help. Pain relief. There is no epidural available at home birth, no IV medications. Pain relief relies entirely on natural methods. The midwife coaches the mother through breathing techniques. Slow, deep breaths help manage pain and keep oxygen flowing to the baby. She suggests position changes. Hands and knees can relieve back pressure. She applies counter pressure to the mother's lower back during contractions. She offers warm compresses. Heat relaxes muscles and provides comfort. The mother labors without complaining. Amish women do not fear childbirth the way many modern women do. They grow up seeing births. They trust their bodies. This cultural confidence makes them less likely to panic or tense up, which in turn makes labor less painful. Delivery. At 7 a.m., the mother announces she feels pressure. The midwife checks dilation again. 10 centimeters, fully dilated. The baby is descending. The mother begins pushing with the next contraction. The midwife prepares the bed with absorbent pads. She lays out sterile instruments on a clean towel, scissors for cutting the umbilical cord, clamps to secure it. Bulb syringe for suctioning the baby's nose and mouth if needed. After 20 minutes of pushing, the baby's head begins to crown. The midwife coaches the mother to push gently to avoid tearing. She applies warm compresses to the perineum to help the tissue stretch. With the next push, the head emerges. The midwife checks quickly to ensure the umbilical cord is not wrapped around the baby's neck. It is clear. One more push, and the shoulders deliver. The baby slides out into the midwife's hands. A healthy baby girl. She cries immediately. The midwife places the baby on the mother's chest, skin to skin. Placenta delivery. The baby is born, but the work is not finished. The placenta must still be delivered. This is the third stage of labor. The midwife waits for signs that the placenta is separating from the uterine wall. The umbilical cord lengthens. The mother feels a mild contraction. The midwife asks her to push gently. The placenta delivers intact within 10 minutes of the baby's birth. The midwife inspects it carefully to ensure no pieces remain inside the uterus. Retained placental tissue can cause bleeding or infection. She examines both sides of the placenta. It appears complete. She sets it aside in a basin. Some Amish families bury the placenta on their property. Others ask the midwife to dispose of it. Next, the midwife checks the mother for tearing. There is a small first-degree tear that does not require stitches. It will heal on its own. She applies pressure with gauze to control bleeding. She massages the mother's abdomen to ensure the uterus is contracting properly. A firm uterus prevents hemorrhage. Newborn assessment. While the mother rests, the midwife performs a newborn assessment. She uses a bulb syringe to gently clear mucus from the baby's nose and mouth. She dries the baby with clean towels to prevent heat loss. She wraps the baby in a blanket and places a hat on her head. Newborns lose heat quickly through their heads. She counts the baby's fingers and toes. She checks for any visible abnormalities: cleft palate, heart murmur, unusual skin coloring. Everything appears normal. She weighs the baby using a hanging scale. 7 pounds, 4 ounces. She measures length, 20 inches. She measures head circumference, 14 inches. All measurements fall within normal ranges. She listens to the baby's heart and lungs with a stethoscope. Both sound clear and strong. She checks the baby's muscle tone, reflexes, and responsiveness. The baby is alert and active. She assigns an APGAR score mentally. 9 out of 10. Excellent. She does not perform routine procedures that hospitals do. No antibiotic eye ointment, no vitamin K injection, no hepatitis B vaccine. Amish families typically decline these interventions. The midwife respects these choices while ensuring the family understands potential risks. She explains that vitamin K prevents bleeding disorders in newborns. She mentions that eye ointment protects against infections. But she does not pressure or judge. Amish families make medical decisions based on their values and their trust in natural processes. The midwife's role is to inform, not to dictate. She also checks the umbilical cord stump. It should be clean and dry. She shows the mother how to care for it in the coming days. Keep it exposed to air. Fold the diaper down below it. Watch for signs of infection like redness, swelling, or discharge. The cord will dry and fall off naturally within 1 to 2 weeks. She examines the baby's skin for jaundice. Slight yellowing is normal in the first days as the liver begins processing bilirubin. Severe jaundice requires medical attention, but this baby's skin tone looks healthy. She checks the baby's hips for developmental dysplasia by gently rotating the legs. The joints move smoothly without clicking or resistance. She inspects the baby's mouth for tongue tie or other abnormalities that might affect breastfeeding. Everything appears normal. Immediate postpartum. The midwife helps the mother into a clean nightgown and changes the bedding. The soiled linens are removed and fresh sheets put in place. She encourages the mother to try breastfeeding. The baby latches immediately and begins nursing. This is a good sign. Early breastfeeding stimulates uterine contractions that help prevent bleeding. It also provides the baby with colostrum, the nutrient-rich first milk. The midwife monitors both mother and baby for the next 2 hours. She checks the mother's vital signs every 15 minutes. She watches for excessive bleeding. She ensures the uterus remains firm. She observes the baby's color and breathing. Both mother and baby remain stable. By 9 a.m., the midwife is confident that the immediate postpartum period is progressing normally. She prepares to leave, but first gives the mother instructions. Rest as much as possible. Drink plenty of fluids. Eat nutritious food. Watch for warning signs of infection or excessive bleeding. Call immediately if anything seems wrong. The family thanks her. She gathers her equipment and heads to her car. During the 2-hour monitoring period, the midwife also watches for signs of postpartum hemorrhage. This is one of the most serious complications that can occur after birth. She palpates the mother's abdomen regularly to ensure the uterus is contracting down to its proper size. A soft, boggy uterus indicates potential bleeding problems. If the uterus does not stay firm, the midwife massages it to stimulate contractions. She also monitors the amount of blood the mother is losing. Some bleeding is normal, but soaking through more than 1 pad per hour signals excessive blood loss. The midwife is trained to recognize these warning signs early and take action. She has medications in her bag that can help control bleeding if massage and breastfeeding are not sufficient. In extreme cases, she would call for emergency transport to a hospital. But most births do not require this level of intervention. She also assesses the mother's emotional state. Postpartum mood changes are common, but severe anxiety or depression require attention. This mother appears calm and happy, bonding well with her baby. The midwife takes time to answer any questions the family has. She reviews breastfeeding positions and offers tips for successful nursing. She explains what normal newborn behavior looks like in the first days. Babies sleep most of the time. They wake to nurse every 2 to 3 hours. They may have several bowel movements per day or only one. Their breathing may seem irregular. These are all normal patterns that worry new parents unnecessarily if they are not prepared for them. Follow-up schedule. Before leaving, the midwife schedules follow-up visits. She will return in 2 days to check on mother and baby. This visit will include another physical exam of the mother to ensure healing is progressing. She will check the baby's weight to confirm the infant is feeding well and not losing too much weight. Newborns typically lose up to 10% of birth weight in the first week before gaining it back. The midwife will assess breastfeeding and offer guidance if the mother is having difficulties. She will return again 1 week after birth for a second follow-up. By this visit, the mother should be feeling stronger and the baby should be regaining birth weight. A final visit happens at 2 weeks postpartum. If everything is normal at that point, the midwife's care is complete. The mother is released from midwifery care and expected to manage on her own. If any concerns arise after that, the family would contact a local clinic or, in serious cases, go to a hospital. Most births follow this pattern without complications. The midwife drives away from the farm as the sun rises higher. She has been awake for 6 hours. She will go home, rest for a few hours, and then continue with scheduled prenatal visits later in the day. The follow-up visits are critical for identifying problems that develop after the midwife leaves. During the 2-day visit, she will weigh the baby again to track weight loss. Excessive weight loss suggests feeding problems that need immediate attention. She will observe a complete breastfeeding session to ensure the baby is latching correctly and transferring milk effectively. She will check the mother's breasts for signs of engorgement, blocked ducts, or mastitis. She will examine the perineum for healing if there were tears during delivery. She will ask about urination and bowel movements, as problems in these areas can indicate complications. She will check the mother's emotional well-being and screen for signs of postpartum depression. The 1-week visit focuses on continued recovery and weight gain. By this point, the baby should be back to birth weight or very close. If weight gain is inadequate, the midwife will troubleshoot feeding issues and may recommend consulting a lactation specialist. She will check the umbilical cord stump to ensure it has fallen off or is close to doing so. She will assess the baby's jaundice levels by examining skin color. She will ask the mother about her energy levels, sleep quality, and overall adjustment to life with the new baby. The 2-week visit serves as a final check before releasing the family from care. If everything has progressed normally, the midwife congratulates the family and reminds them that they can call if concerns arise later. She leaves knowing that she has provided comprehensive care from early pregnancy through the critical first weeks of the baby's life. As she drives away, she thinks ahead to her next appointment, a prenatal visit with a mother expecting her 8th child. The work continues without pause. This single birth represents one of approximately 200 the midwife will attend this year. 200 calls at all hours, 200 drives to remote farms, 200 labors monitored without hospital equipment, 200 babies delivered in bedrooms instead of sterile delivery rooms. The work is exhausting. It is unpredictable. It requires physical stamina, emotional resilience, and constant availability. The midwife cannot plan vacations or turn off her phone. She is on call every day of the year, except when she arranges backup coverage with another midwife. The pay is modest. Amish families pay between $2,000 and $4,000 for complete prenatal, delivery, and postpartum care. This is far less than hospital births, which can cost $15,000 or more. But it is also far less than what the midwife could earn working in a hospital setting with regular hours and benefits. She continues this work because she believes in it. She sees the value of allowing women to birth in familiar environments surrounded by family. She witnesses the confidence and calm that Amish women bring to labor because they have not been taught to fear it. She knows that most births are normal physiological processes that do not require medical intervention. Her role is to monitor, support, and intervene only when necessary. From call to delivery to postpartum, she provides comprehensive care that respects Amish culture while maintaining medical safety. 200 times per year, one birth at a time.